Hello, Center for Women in Transition supporters. My name is Tracie Striebel. I am a behavioral health specialist, trauma therapist, and EMDR therapist here at the lovely CWIT, and I'm here to tell you a little bit about the services that we offer through behavioral health here at CWIT. First and foremost, it is our top priority to offer trauma-informed care across all of our services. And what that really means is simply an overall sensitivity to the fact that our population has experienced extensive amounts of trauma, typically starting in early childhood and going all the way up through the time that we meet them and they come through our doors. So we approach everything that we do with that respect and that knowledge that they have been through a lot, and we have to handle all of their needs very individually and understand that certain things are going to possibly trigger or re-traumatize some more so than others, and we avoid any triggers, any re-traumatization at all costs, and handle them all with an extreme sensitivity, knowing they have been through so much trauma. And when we talk about individual services, I'm going to give a little bit of a breakdown of what the services are that we do offer. We offer individual one-on-one counseling. We offer group counseling. We offer EMDR therapy, which is one-on-one always. We offer Smart Recovery, which is an alternative to the traditional 12-step, NAAA programming, which is phenomenal in itself, obviously. But Smart Recovery is just an alternative to that. Probably my favorite thing to do with the women is to sit down with them and create individualized treatment plans. And in those plans, we target what symptoms they're looking to really work through. Oftentimes they have symptoms that are present from whatever diagnoses they have, usually schizophrenia, bipolar disorder, borderline personality disorder, depression, anxiety. Very often they're already diagnosed with PTSD. So we really work with them to help them manage the symptoms that accompany those diagnoses. And some don't even have a diagnosis yet, but are experiencing those symptoms. So we really work with them on managing those symptoms and on also creating goals for their time at CWIT and for their time beyond CWIT. Some of these goals can be very existential in nature, revolving around, who am I? How do I need to change my life to really do what I want to do out there in the world? So we work very hard with them with those treatment plans to create some very individualized goals that are very, very important to them. And we review these treatment plans every 3 to 6 months and tweak where we need to and celebrate the successes. So that is just barely scratching the surface of what we do here with behavioral health. But just to give you kind of a rough idea, there is so much more, but this video is just too short for that. So just wanted to give you a little bit of info and explain as well, especially with this COVID-19 pandemic happening right now, we are working very hard with our women to help them navigate through this, just as well as, the rest of the community is trying to navigate too. Anxiety is running very high worldwide right now, obviously, and we are really, really focusing on our women right now and doing our best to help keep them safe, both physically, health-wise, and mentally. So thank you for your time. Thank you for your support. Thank you for everything that you do. We here at CWIT, the clients that we serve and the staff are very grateful, and so is the community, because ultimately our goal is reintegrating our population back into the community. So the staff, the clients, and the community, thank you. Please be safe and stay healthy out there.